Hello everyone. In this video, we will see the anatomy of femoral triangle. So in the femoral triangle, we will see the introduction, boundaries, contents and clinical anatomy. Femoral triangle is the triangular depression in the upper one-third of the front of thigh. It is lying below the inguinal ligament with the apex directed below. It is also termed as Scarpa's triangle. So these are the boundaries of a femoral triangle. The base is formed by the inguinal ligament superiorly. Then laterally it is bounded by the sartorius and medially it is bounded by the adductor longus. The apex is directed below and it is formed by the meeting point of lateral and medial borders. Now the roof. In the roof of the femoral triangle, we have the skin, then superficial fascia, and beneath the superficial fascia we have deep fascia. The superficial fascia in the femoral triangle contains some cutaneous nerves and vessels. The nerves are lateral, medial, intermediate cutaneous nerve of the thigh, ilioinguinal nerve, femoral branch of genitofemoral nerve. And the blood vessels in the superficial fascia are the superficial branches of femoral artery like the superficial epigastric artery, superficial external pudendal and superficial circumflex iliac artery and their corresponding veins. Also, we have superficial inguinal lymph nodes in the superficial fascia. The deep fascia in the femoral triangle, that is the fascia lata, it has a specialized modification, that is the saphenous opening. So the inguinal lymph nodes which are found in the femoral triangle, these are arranged in two groups, the superficial and the deep group. The superficial inguinal lymph nodes, these are arranged in inverted L-shaped form. The horizontal group lies along the lower border of the inguinal ligament, as we can see in the diagram, and the vertical group, it lies along the great saphenous vein. The deep inguinal lymph nodes, these are lying along the femoral vein and they are found in the femoral canal. So these are the deep inguinal lymph nodes which are showing in the green color. These are the deep inguinal lymph nodes. These are 3 in number and they are found in the medialmost compartment of the femoral sheath, that is termed as femoral canal. Now the great saphenous vein which is found in the superficial fascia. This vein originates from where the dorsal vein of the first digit, that is the large toe, merges with the dorsal venous arch of the foot. So this vein, after passing anterior to the medial malleolus, that is at the ankle over here, it runs up the medial side of the leg. Then at the knee, it runs over the posterior border of the medial epicondyle of the femur. Then this great saphenous vein courses laterally to lie on the anterior surface of the thigh before entering into an opening in the fascia lata, that is the saphenous opening. After crossing this saphenous opening, it terminates into the femoral vein. Now the deep fascia, it is modified into the saphenous opening in the femoral triangle, as we can see. The margin which is morely incurved in this femoral triangle is the falciform margin of the saphenous opening, which is lying on the lateral aspect. This saphenous opening is covered with a superficial fascia which is termed as the cribriform fascia. This cribriform fascia means the sieve-like fascia. It is sieve-like because it is traversed by the lymphatic vessels which are connecting the superficial and the deep inguinal lymph nodes. Also, the superficial branches of the femoral artery, they are passing through this cribriform fascia. Now the floor of the femoral triangle, it is formed from lateral to medial side by the iliacus muscle, then psoas major, then pectineus and then adductor longus muscle. So these are the boundaries and the floor of the femoral triangle. Now the contents of the femoral triangle, it includes from lateral to medial side, that is the femoral nerve and its branches, femoral artery and its branches, femoral vein and its tributaries, lymphatic vessels and some deep inguinal lymph nodes, and the great saphenous vein which is lying in the superficial fascia draining into the femoral vein. Now these are the contents of the femoral triangle. Except the femoral nerve, these are enclosed within a sheath which is known as the femoral sheath. This femoral sheath has two walls. One is the anterior, which is formed by the fascia transversalis, and the fascia iliaca, which is the posterior wall. It has three compartments. The lateral compartment, which is termed as arterial compartment, because it is containing the femoral artery. Then the middle compartment is the venous compartment containing the femoral vein, and the medialmost compartment is the femoral canal. So these are the three compartments of the femoral sheath. This femoral canal contains the deep inguinal lymph node, which is termed as lymph node of Cloquet, and some loose areolar tissue is found in the femoral canal. This femoral canal is the medialmost compartment. It is conical in shape and it is only 1.25 centimeters long. Its base is directed above and forms the oval ring, which is termed as the femoral ring. It is also 1.25 centimeters in diameter. This ring is closed by the extraperitoneal tissue, and this extraperitoneal tissue is termed as femoral septum. This septum is pierced by the lymphatic connecting the deep inguinal lymph nodes with the external iliac lymph nodes, and there is a small recess of peritoneum over this femoral ring, which is termed as femoral fossa. So here we can see the femoral ring, which is the superior border of the femoral canal. The boundaries of the femoral ring are: anteriorly it is bounded by the inguinal ligament, posteriorly it is bound by the pectineus with its covering fascia, medially it is bounded by the lacunar ligament, as we can see in the diagram, and laterally the femoral vein. Now the structures which are related to the femoral ring are the spermatic cord in case of males and round ligament of uterus in case of females. These structures lie immediately above the anterior margin of the ring, and superolaterally to the femoral ring we have the inferior epigastric vessels. So these are the inferior epigastric vessels which are lying superolateral to the femoral ring. Now before proceeding to the details of the contents of femoral triangle, we must know about the abdominal aorta. So this is the abdominal aorta, which is dividing at the level of L5-4 vertebrae into two common iliac arteries. These common iliac arteries further bifurcates into external and internal iliac arteries at the level of sacroiliac joint. Then this external iliac artery enters into the thigh below the inguinal ligament, and it is now termed as the femoral artery. So this femoral artery, it is the continuation of the external iliac artery. Its course is extending from the mid-inguinal point up to the apex of the femoral triangle, and the mid-inguinal point is the midway between the anterior superior iliac spine and the pubic symphysis. In its course in the femoral triangle, it provides 3 superficial and 3 deep branches, and further at the adductor hiatus it continues as the popliteal artery. So the branches of the femoral artery in the femoral triangle, these are the 3 superficial branches, that is the superficial epigastric, superficial external pudendal, and superficial circumflex iliac. These branches are depicted in the diagram. Then the 3 deep branches are the profunda femoris artery, deep external pudendal artery, and the muscular branches. So these are the branches of the femoral artery. This profunda femoris artery, it further provides the medial and lateral circumflex femoral arteries, 3 perforating arteries, and the 4th perforating artery is the continuation of the profunda femoris artery. So this is the adductor hiatus, which is an opening in the adductor magnus muscle through which the femoral artery passes and enters at the back of the knee, and now here it is termed as the popliteal artery. Then this is the descending genicular artery, which is a deep branch of the femoral artery which participates in the anastomosis around the knee joint. So this is the formation of popliteal artery when the femoral artery passes through the adductor hiatus and reaches the back of knee, and now its name changed to the popliteal artery. Now the femoral vein. This femoral vein is the continuation of the popliteal vein and the adductor hiatus. The tributaries of the femoral vein, these are corresponding to the names of the branches of femoral artery, and further at the midinguinal point, that is just medial to the midinguinal point, it is further continues in the form of external iliac vein. Now the femoral nerve. The femoral nerve, it is the dorsal division of the anterior primary rami of L2, L3, L4. After taking origin from the lumbar plexus, it enters into the pelvic cavity and then it passes below the inguinal ligament, and here it divides into two divisions. One is anterior division, other is posterior division. The anterior division provides one muscular branch and two cutaneous branches, and the posterior division provides four muscular branches and one cutaneous branch. The four muscular branches are branches to the muscles of front of thigh, and the anterior division, it is providing only one muscular branch to the sartorius. Further, it provides the articular branches to the hip and the knee joint and vascular branches to the femoral vessels. So here we can see the femoral nerve, which is passing lateral to the femoral artery, and then it is dividing into the two divisions. So this lateral circumflex femoral artery is responsible for the division of the femoral nerve into two divisions. This is the formation of the femoral nerve from the lumbar plexus. Now the deep inguinal lymph nodes, these are 3 in number, and these are located medial to the upper part of the femoral vein in the femoral sheath. The lowest one is situated below the junction of great saphenous and the femoral veins, and the middle one in the femoral canal, which is termed as the gland of Cloquet or Rosenmuller, and the greatest one is in the femoral ring. Now the lateral cutaneous nerve, this is the another branch from the lumbar plexus, and it is passing along underneath the lateral border of the psoas major above the iliac crest. It runs downwards and laterally across the iliac fossa in front of the iliacus muscle under the cover of iliac fascia. Then it enters the thigh by passing below the lateral end of inguinal ligament, and occasionally it goes through the inguinal ligament. It also provides cutaneous innervation to the upper lateral aspect of the thigh. Now the clinical anatomy. First is the femoral artery. The pulsations of the femoral artery can be felt at the midinguinal point. Then the access to the femoral artery can be done through the femoral triangle during the coronary angiography at the midinguinal point. So this is the angiographic procedure. This femoral artery can also be used for catheterization during angiographic procedures because it is superficial and easily accessible through the front of the thigh. Now the femoral vein. This can be used for intravenous infusions in case of infants because it is larger in diameter and easily accessible in comparison to the upper limb veins. Now meralgia parastatica, it is the compression of the lateral femoral cutaneous nerve through the inguinal ligament. Because of its compression, it causes a pain paresthesia condition at the lateral aspect of the thigh. Now the femoral hernia. Hernia means the abnormal protrusion of the viscera through the opening in the wall of the cavity which is containing in it, and this femoral hernia protrudes through the femoral ring. It is more common in females than males due to larger femoral ring and the femoral canal. So this femoral hernia, it is more common in females because of the larger femoral canal, wider pelvis and the small size of the femoral vessels. The direction of the hernial sac is downwards, forwards and upwards through the femoral canal. So to repair the hernia, the direction should be opposite, that is downwards, backwards and upwards. The coverings of the femoral hernia from within outwards include the peritoneum of the hernial sac, the femoral septum, the anterior wall of the femoral sheath, the cribriform fascia, then the superficial fascia and the skin. So this is the aberrant obturator artery, which is sometimes a branch of inferior epigastric artery. This must be cautiously observed during the hernial sac repair because it is lying just behind the hernial sac. So the difference between the femoral hernia and the inguinal hernia is that the femoral hernia lies inferolateral to the pubic tubercle, while the inguinal hernia lies superomedial to the pubic tubercle. So this completes the femoral triangle and it's applied. Thanks for watching.